Good morning, all. Let's begin the session
Adalins,
with
we
a
can
silent
start.
prayer. Every year, 8th of June is celebrated as World Brain Tumor Day. This initiative was initially taken by the German Brain Tumor Association and is now celebrated worldwide to raise awareness and educate people about the brain tumor. There are lots of myths and misconceptions
Hello,
about brain tumor among the general population, and we take this
കേൾക്കാമോ?
opportunity to know more. Yes, Doctor Keka.
Doctor,
Now I invite Samson of First Become CA for the welcome speech.
Respected dignitary, staffs, and my dear friends, a warm good morning to one and all. It gives me an immense pleasure to introduce the chief guest of the day, Dr. Dilip Panikar,
Hello.
Senior Consultant. He is an
Hmm.
exceptional talent neurosurgeon with more than 26 years of experience to his credit. Dr. Dilip Panikar is also one of the most respected doctors in the country and an expert in microneurosurgery. His skills are highly advanced and his unique neurosurgery procedures are unparalleled. It is our honor to have you, sir. Welcome, sir.
Okay, ഞാൻ പറയുന്നത് കേൾക്കാമോ? Can you hear me?
Yes,
Yes,
sir.
sir.
Yes, sir.
Okay, good. Thank you. I'm sorry for the technical glitches. Uh, First of all, thank you for inviting me to interact with your students, and welcome to everybody. Now, the topic that I will be speaking on today, as you might have guessed, is brain tumors. And the reason being that the 8th of June, that is yesterday, is recognized the world over as the World Brain Tumor Day. Now, why has this ever come about? Is there a day for brain tumors? അതിന് എല്ലാത്തിനും കുറേ ദിവസങ്ങളുണ്ട്. Some many we know, and there are a lot that we do not know. But why brain tumors? Now, this was set up in the early 2000s by the German Brain Tumor Association. And this was set up with the motive, with the objective that there is a lot of ignorance and myths about brain tumors, not only in the country but all over the world. And this day was set up in an attempt to promote awareness about this entity and to educate people about what this entity is and what can be done about it. Even for most people, their knowledge of brain tumors comes from media or very often from movies and television serials, where the brain tumor is depicted as something that is absolutely horrible, completely, and something that is almost like a death sentence. So, Ganipa, what I will do is to take you through a very short presentation to give you an overview of what this entity is, നമ്മളെങ്ങനെ കണ്ടു ഇതിനെ, and what can be done about this. So, let me take you to my presentation. Can you see my screen?
Yes, sir.
Okay, very good. So let me start with this. So once again, good morning, welcome to everybody. My name is Dr. Dilip Panikar, and I work at Aster Medcity. Now, see, namely brain tumor na vaak parayumbam. What do we understand by brain tumors? What is the first thing that comes into our heads? So I have put down a few terms here. You can see, and all these terms, which range from death, coma, major surgery, prolonged rest, loss of livelihood, abnormal behavior, paralysis, burden to family, dementia, headache, cancer, inability to lead a normal life. None of these are pleasant. None of these are something that make you feel comfortable or give you some kind of solace. So this is the common association. This is what the word brain tumor induces in everybody's mind when you hear this for the first time. What exactly is a brain tumor? So let me take you through the basics. Now, many of you, I believe, I understand, are students of zoology, students of science. Some of you are students of commerce and other disciplines. But these are some very basics, which most people would have studied in school. This is how cells grow. You start off with a normal, healthy cell which keeps dividing and then it keeps growing. That is how the normal human body grows, all the tissues in the human body. Now, what happens is at some point, supposing one of the cells becomes damaged for whatever reason, we know that there is a genetic code that is programmed into every cell. So, what happens if the genetic code gets corrupted or there's some damage to the cell? There is a natural way to get rid of that cell. There's a programmed cell death where every cell grows and at some point dies. It has a built in life. And this is how we live. This is how every living organism uh, functions. This is a natural cycle. What happens when this process gets disrupted? This is what happens when the normal controls stop working. There is an uncontrolled division of cells, and these cells, one type of cells, keeps on growing, and this is what forms what we call a tumor, where there is a uncontrolled growth of one or a particular type of cell, and this over time becomes a mass of cells, what we know as a tumor. Now, all these are abnormal cells, and the important thing is they are cells that have broken through the normal regulations of the human body, and that is why they have chosen a path that makes them autonomous. Now, when we look at the brain, there are different parts of the brain. Now, again, for students of science, you would know this. You have a frontal lobe. You have what is called the cerebrum on the top, the cerebellum below. You have the brain stem that connects with the spinal cord, and this is what the normal brain is. And the brain is enclosed in this bony shell of the head, so it is well protected. Now, with the different parts of the brain, there are so many different structures inside the head. It is not only the brain. There is blood vessels, there are linings, there are membrane linings covering the brain, and any of these can form tumors. So, when we look at tumors, what is a tumor? Like I told you earlier, it is a kind of a growth. So, a tumor can either be something what I told you earlier, what we call a neoplastic tumor, that is a new growth. Now these can be tumors that grow either directly from the normal structures inside the head. It can be from the brain, the linings around, the pituitary gland, which also sits below the brain, the nerves, and all these other structures. It can also be tumors that form somewhere else in the body and spread to the brain. Now, these are the most common types. Having said that, there are other what we call the so-called tumors or the non or the tumor-like conditions. Now, these are not truly tumors. They are not truly tumors, but they behave like tumors inside the head. They could be infections, they could be abnormalities of blood vessels, there could be fluid collections, and so on and so forth. There are so many of them. Now, how do these tumors present, or what symptoms do they cause? There are a whole lot of symptoms that they can cause, and this is how we find them. One is related to what we call a rise in the pressure inside the head, the raised intracranial pressure. And this can present with headache, with vomiting, with the blurring of the eyesight, with the level of consciousness coming down, and so on and so forth. Your patients can have fits, seizures, convulsions, epilepsy. This could be one of the signs by which a brain tumor presents. There could be a weakness. There could be either a weakness of the hand or the leg. There could be an affection of the eyesight. There could be a problem with the hearing. Now, all these can also be because of a tumor. There can be what we call cognitive decline, a decline in the cognition. Now, cognition is the normal uh, state of awareness of the brain and covers all the functions that is necessary for a good social interaction or to communicate with the external world. This includes things like awareness, intellect, memory, uh, visuospatial cognition, that's finding your way around. Now, all these, there could be abnormalities in this, there could be changes in personality that could be the sign of a brain tumor. Some of the tumors that arise from the gland inside the head, the pituitary gland, they could cause abnormalities of hormone function. They could be either increase in the level of hormones or a decrease in the level of hormones, and that can cause effects all over the body. Very occasionally, some of these tumors can present like a stroke very suddenly, where there is a sudden headache, there's a sudden loss of consciousness, there's a sudden weakness. So, something that is catastrophic, a sudden event. And some of them can be what we call incidental tumors, which means I'll give you a classic example. Somebody is traveling on a two-wheeler, falls off, hits their head, and is taken to the hospital. Now, when they are taken to the hospital, the emergency room decides that no, this person had a traffic accident, and we should look and we should do a scan. You do a scan, and then you find a tumor sitting there. So this is also happening in this day and age. Once we suspect a brain tumor, how do we confirm it? We confirm it with scans, with different kind of scans. The most common scans are the CT scan or the MRI scan, which you might have heard of. There are other specialized tests that we do to confirm the presence of the tumor. Now, this is what a typical scan looks like, and this is what a tumor looks like on the scan. You can see this very ugly looking thing, some small, some big, some very big. Now, this is what a tumor looks like. These are very specialized kind of scans, what we call PET scans, which are nuclear scans where the patient is injected with a radioactive tracer, and this lights up the tumor and also shows us where the tumor has spread. So we have different kinds of scans and different sequences on the scan that will help us to identify the tumor and identify and to determine lots of other things about the tumor. These are again specialized kinds of scans which are now very commonly available and done. For the students of science, you would recognize that this is what is called a spectroscopy. It is done using the MRI, the magnetic resonance imaging, and this gives us a chemical signature of the tumor. And the chemical signature of the tumor can also tell us a little more about what kind of tumor it is. Same way, there are different sequences that can study blood vessels. This is an angiography where you see the blood vessels of the brain very clearly with an MRI scan. So these are the specialized, this and there are many more. They're very specialized kind of scans that can tell us, that can give us huge amount of information about the brain and the tumor. And this is what we need to be able to plan the treatment. Well, when we talk of treatment, what kind of treatment is it? It is usually a combination of these three: surgery, radiation therapy, and chemotherapy. And very occasionally, there are some very benign tumors, there are some very commonplace tumors which are not causing the patient any problem, which we may opt to just wait and watch and see what happens to them. Sometimes nothing may happen, and the patients may be able to lead their normal lives without any active treatment. So this is an example of a very typical kind of tumor that is seen in the brain. And before we go ahead with treatment, there are very specialized, like I said, we need to get a lot more information about this tumor. And for that, we use specialized scans. Now, when we look at the tumor on the surface, when we look at the brain on the surface, all we see is the outline of the brain. We know that certain parts of the brain control certain functions, or they're responsible for certain functions, like control of movement, control of language, control of memory, control of intellect, and so on and so forth. But how do we know that? The brain does not have any signposts all over you. So when we open up, we don't have signposts. We don't have a direction board saying, okay, the brain area that controls movement is here, or the brain area that controls memory is here. We don't have those things. So for that, we need that other information. This is one of the sequences that we do. This is what we call a fiber tract imaging, immersion tractography. So what you see here are not paintings, they're not drawings. These are actual scans of people's brains. Now, these lines that you see are all the fibers that lie within the brain, and they connect different areas to each other. And each one of these fibers is important. These are things we cannot see with the naked eye. But when you do scans like this, you get this. And the color coding comes from the direction of the fibers, whether they are traveling vertically, horizontally, or side to side. So they are color coding, and there's a combination of colors that tells us exactly which fiber is which. So this is the kind of information that we need to be able to plan treatment, and in a very safe way. Same way, there are sequences, there are tests to determine which area controls what. Like for example, we have a technique what we call a functional MRI, where we can identify parts of the brain that control certain functions. Now, this small signal that you see lighting up here, this is the same tumor that I had shown you. This is a small, this signal that you see here indicates a part of the brain that controls movement. So once we know all this information, it helps us to integrate the whole thing together and have a map like this, where you have the tumor, you see all the fibers around, you can see how the fibers are being displaced around the tumor, and this helps us to plan treatment in a very safe way. Now, the treatment, like I said, is largely a surgical removal of the tumor. Now, surgery for these tumors is fairly common now, and compared to what it was about 20 years ago, 20 or 30 years ago, when I started my practice, where we used to consider these as extremely high risk surgeries. And this day and age, the situation has changed so much that it has become fairly routine and commonplace. And now we say that the risk of a average brain tumor surgery like this is fairly straightforward, like the risk of any surgery anywhere else in the body. We have safeguards, we have methods to make the whole procedure very safe, and that is what helps the patient to get a much better outcome. What has also changed over time is the focus of treatment. At one time, like I said, 30 years ago, when I started training, it was preservation of life at any cost. But now it is no longer that. It is preservation of function. The whole idea is we should be able to get patients back out of the hospital, back into their lives, back into work at the earliest, so that they continue to lead productive lives for themselves and their families. And this is a very important philosophy that has changed over time and has dictated how we manage a lot of our tumors. We have all these methods, we have all these adjuncts, the operating microscope, image guidance. These are all tools that help us during the surgery and to make surgery very safe for the patient. And we also use in certain cases specialized techniques like awake surgery, where the tumor can be removed with the patient remaining awake through the operation. The biggest advantage of this is the fact that the patient's important functions can be checked continuously all through the procedure. So it's a great reassurance for the patient and the family and the surgeon. So once we take the tumor out, we do what is called a biopsy, where the tumor is studied in great detail, and that is how the tumor is. We determine what kind of tumor it is, what is the nature, and this tells us the prediction of the behavior. This is very important for further care. Surgery becoming the first step. What lies ahead? So we know the behavior of that, we know the type of tumor, the grading, and then from that the behavior. For that we have a lot of different kinds of studies where the tissue is stained in different ways using specialized immunohistochemical markers. There are certain genetics tests that are done, and all these are an effort to characterize the tumor, to understand the behavior of this tumor down the line. We have specialized techniques that help us during surgery. This is one example where we use a fluorescein dye that highlights the tumor, and under ultraviolet light it glows, and it helps us to remove the tumor as completely as possible. These are all developments that have happened over the last 10 years, and they continue to develop as tools develop, as understanding develops, as newer advances come in and get incorporated into clinical practice. The entire procedure, the treatment becomes more effective and safer for the patient, and this is what we really look forward to. There are also specialized techniques like intraoperative imaging. During surgery, we can do MRI scans. You can see this is an operating theater with an MRI scanner built in here, and we have this. During the surgery, the patient can go straight into the scan. In the middle of the surgery, the scan can be done. We can determine what is happening, what part of the tumor is remaining, and then go back and complete the surgery. We have this facility with us at Aster, and we are in the process of using it very regularly. There are other different kinds of tumors. Like I said, the tumors that arise from different sites. These are some examples of these. This is what a small tumor like this looks like when it is taken out. These are bigger tumors which can all be removed with a great degree of safety. The tumors arising from the pituitary gland, again, very common. Like I told you earlier, these are the ones that present with abnormalities of hormonal function, and they can present in very bizarre ways across the body. And we have different ways of managing it. This is one of the very common ways now where we do a minimally invasive surgery using an endoscope through the nose to approach these tumors and to take them out. As you can see here, this is a tumor in the pituitary that gets completely removed through the nose. So these are specialized kind of surgical procedures that are done for these fairly common tumors. Now, when we talk of, now there are certain kinds of tumors that are malignant, more aggressive in their behavior, and this is what we determine when we study the tumor, when you understand the pathology, and that is when we go further and use techniques like radiation. Now, how has radiation also changed? Now, radiation, what we know and what the popular literature says, is very damaging. The moment you say radiation, you immediately think of the atomic bomb or the atomic explosion, where there is a tremendously bad effect from the radiation. But this is radiation that is therapeutically used, that is used at a level, at a dose threshold that is designed to destroy abnormal cells while protecting the normal cells as far as possible. And what has changed over the years is the technique of radiation. This is what we used to do at one point of time earlier, the what we call the whole brain radiation. And now the radiation is more and more focused, and now we can very specifically, precisely deliver a very, very high dose of radiation to a very small part of the brain, or for that matter, anywhere in the body, protecting all the structures around that. And we have very specialized techniques and devices that allow us to do this. Again, improves the efficacy, reduces the complications and the side effects of treatment. There are other advances that are in process. Some of them are available to us, some of them are still in the laboratory. This is one that is available where you have a biodegradable biodegradable material that we put into the tumor bed at the end of surgery, and that releases chemotherapy directly into the tumor bed. These are other developments that are still in the lab, where we use viruses as a vector to deliver drugs or to cause genetic alterations in a tumor that can destroy tumors. Some of it is reaching the stage where it is going to become available at large. But these are only a few examples of the vast number of developments that are happening with regard to the treatment of brain tumors. A few commonly asked questions, since I'm sure many of you will have some of these questions, let me quickly run through them. What causes brain tumors? We really don't know what causes brain tumors. We know that most tumors have some kind of a genetic abnormality that is identifiable. Now, are these tumors hereditary? In the vast majority of cases, no. There are some genetic syndromes, like, for example, you might have heard of what is called the neurofibromatosis syndrome, where they are hereditary, where they are genetically transmitted across generations. There are also certain oncogenes that run in certain families that make the families prone to develop certain kinds of tumors. There is an increasing understanding going on about this. There are also methods now, there are certain experimental drugs that can be used to switch off certain oncogenes or to block the action of certain molecular pathways. And this is what a lot of the research is heading towards. Mobile phones and brain tumors, a very common question. There have been large scale studies run by the World Health Organization and many and the FDA and many organizations the world over that tell us that have examined this risk between a mobile phone and usage and brain tumors. Again, popular literature says that excessive use of the mobile phone can cause brain tumors, but all the large scale studies say that this incidence is anecdotal. We still do not have conclusive proof that the radiation emitted from mobile phones and mobile towers can cause brain tumors or other kinds of tumors in the body. However, the World Health Organization has issued an advisory on the basis of this, saying that the vulnerable population, there are two groups that are very vulnerable. One is children, and the second is pregnant ladies. They recommend that the usage of mobile phones be limited in these groups because of the possibility of certain effects that the radiation from these devices may cause. There is no conclusive proof, but there is an advisory, and it is well, and it would be wise to follow that. Surgery, like I said, the risks of surgery is something to be feared. Surgery, like I said, has changed dramatically over time. It is not only the technique of surgery, the devices, the tools that are available to us, but also things like the anesthesia has become a lot safer. The drugs used for anesthesia is a lot safer. The post-operative care and the intensive care is also a lot different now. And very typically for a tumor, like I showed you earlier, the person would be in the intensive care unit for 1 day after the operation. The next day would be shifted out back to the ward or the room, would be mobilized, made to walk, and maybe by the third or fourth day they'll be sent home. It's as quick as that. Care after surgery for a brain tumor. Yes, like any other operation, the routine care and precautions have to be taken, but we encourage activity. We generally do not ask people to take rest or to avoid activity. We tell them to get back into the normal activities and lives as far as possible. One important proviso that I have is driving, because brain tumors, as they affect the function of the brain, can potentially affect alertness and response times. Driving is something that has to be undertaken with extreme care, and I generally advise patients to restrict or to withhold driving for at least 3 months after an operation until they're absolutely fit and fine. Can one look forward to a normal life after treatment? Certainly, yes, unequivocally. So, as a take home message, I will tell you brain tumors can affect any age or sex. There are different kinds of tumors all over. Not all of them are malignant. There is a certain proportion that are malignant. The vast majority of them are benign tumors. Early detection is extremely important. And that is why we are very careful about the signs, the symptoms, and the signs of a brain tumor. And we always recommend that if anybody has persistent issues with headache or behavioral abnormalities or things like that, consult a doctor at the earliest. There are other tumor-like conditions, like I said, like infections and all, which can behave like tumors, but they are not truly tumors. They can be treated very effectively. The myth that brain tumors are uniformly fatal has to be dispelled, has to be got out of everybody's mind. And I see it, and I do hope that the media and especially the movies and the television serials stop depicting brain tumors in a way that induces fear in everybody's head. A lot of the ongoing developments have helped make this entire process of detection and treatment safer, and this continues to happen. And over the next few years, 5 or 10 years, we can see it. We look forward to a tremendous number of developments in regard to the treatment of brain tumors. This is one of the examples, the use of augmented reality. These are images of a brain, the fiber tracts in the brain, and using procedures like augmented reality can really help understand the inner structure and the inner workings of the brain. And this is practically available now. This is not science fiction. This can actually be done. Thank you. I'll be happy to take questions, and please don't hesitate to ask me anything what you would like to. Go on.
Good morning, sir. Can you hear me, sir?
Yes, I can, loud and clear. Tell me.
Sir,
Now,
I have
if you ask a question, please identify yourself with your name. So I'd like to know your question.
Sir,
Okay?
my name is Ashwin. Sir, normally when a person is affected with a disease, we used to consult a doctor. At that time, doctor used to tell that the presence of mind, right? The patient should have a positive mind that this comes and usually goes. But in case brain tumor, this is a disease which affects the brain of a person. Does the presence of mind plays an important role in curing this disease?
Always, always. The fact that the doctors of old used to keep telling you about the positive state of mind, not only with regard to illness, but even as part of your health, is extremely important. Extremely important. See, it's very, very easy to get drawn into negativity. It's very easy to get drawn into negativity. But this is where the inner personality of a person has to be pushed, and the thoughts have to be more positive. Yes, that you look forward to something better. Yes, we might have problems today, but tomorrow will be a better day. That is a thought that we all have to have. And this is where the support from the family, the friends, and everybody around is so very essential. It's so very essential. Now, one of the things that many people with brain tumors have, either as part of the disease or because of the fear that it induces, is a sense of depression. And very often, we have, as part of our treating team, a psychologist who sees our patients and helps them and the family through the entire process of treatment. This kind of support is absolutely important, but what you say is true. The positive frame of mind, it's extremely important.
So another question is that you have been told that one of the method that is observation, like observation of the patient. Like a person who is affected by brain tumor, we will be observing them for a few months and all, and after that, even at that stage, they will not be showing a minimum symptoms. Right after that, also they will be leading a normal life, but sometimes there can be complications. Like
Okay. Now, when we say We exactly mean that. It is not leaving them alone. It's not telling them no treatment at all. You don't need treatment and go away, don't come back. When we say observation, there is a process of observation. Not every tumor is observed. There are certain kinds of tumors. There are certain small tumors that we occasionally find, which we tell people that, okay, right now, you may not require any treatment. But that does not mean that you will never require treatment. You may require treatment down the line. So what we need to understand is the behavior of the tumor. And that is where, when we observe a patient who has a tumor, we observe a person who has a tumor, it is always with serial scans. It is not waiting for problems to develop. It's not waiting for them to develop symptoms or problems of a tumor, which sometimes can happen only when it becomes very big. You don't want that to happen. What we want to see is, when we do scans at regular intervals, what we want to see is the tumor that we see on the scan remaining the same. And if that happens, we continue to follow them up as long as the tumor remains quiet, as long as it does not change in the size. And this typically does not happen over months. It happens over years, because some of these tumors can take years to grow. So we typically follow these tumors for at least 10 to 15 years before we say, okay, now we know the tumor is stable and we may not need to continue follow up any longer. What is also important is the age at which the age of the person when this is detected. The younger the person, the longer the duration of follow up. The older the person, the less the duration of follow up. So this is also very important. So it is always, observation means constant medical supervision. It may be once in 6 months, it may be once in a year, but there is a check, there is an oversight on the tumor.
Thank you, sir. Sir, one of my friend has been raised a question in the chat box. Can I read for you, sir?
Does the current life? Okay, one minute. Let me hit the chat box. Let me find out. Okay, could you take us? Okay, okay. There are two questions that are here. One, I will say, does the current lifestyle factors such as diet, stress, sleep lead to brain tumor? No, they don't lead to a brain tumor, but they can worsen the symptoms that a brain tumor causes. So what we always say is, the fundamental principles of a healthy lifestyle, that is proper nutritious diet at regular times, maintain proper habits, sleep and wake. The sleep hygiene is very important. So you sleep at the right time, wake up at the right time, so that you get this good quota of sleep that protects you during the day. Your awake times, you remain alert during your awake times. Now, all these are fundamental tenets of maintaining a basic health. They don't have a direct relationship with the cause. They are not causes of a brain tumor. Okay. The next question that we have here is, can you take us through the procedure of a typical awake surgery? Okay, this is a very technical question. Now, the principle of an awake surgery came up because people realized that the brain itself, even though it is the organ that senses pain and other sensations from all over the body, itself cannot feel pain. The brain does not have any pain sensors. Though it is an organ that senses pain and perceives pain and makes somebody aware of pain, but it itself does not sense pain. So, when we do these operations, we take advantage of that fact. So when we do the operation, now what causes pain here? When we cut the skin, when we cut the bone, that is what causes pain. So at that time, we can either use a local anesthetic to take off that pain, or we can sedate the patient so that they are asleep during that part of the operation. But once the cuts are made, once a bone is open, and once we are seeing the brain, then there's no more pain. Then we can continue to operate. We can take tumors out from within the brain while the person is awake, talking. We can check movements. We can check eyesight. We can check hearing. We can check language. And now we can even check now the some of the protocols that we now use. Now, this would be very interesting for the psychology students if you have any amongst you. We can also check cognitive functions. We can check memory. We can check mentation. We can check visual spatial coordination. We can check emotions. There are tests that will determine all that, and they all help to make the surgery safer and more effective. And once the main part of the operation is done, we can again give sedation and put the person to sleep, so that they don't feel any discomfort through the rest of the operation while the wound is being closed up. So this is how an awake surgery is done.
Sir,
Okay.
hello.
Yeah.
So my name is Abdul, and I have a follow-up question to that. How do you handle the person's state of mind while conducting an awake surgery? Because a part of
Yes.
their head will be open, and then have they resisted anything like that?
So there is now when we say an awake surgery, there is a process of preparing somebody for an awake surgery. We obviously cannot take somebody who comes to you and put them on a table and say, okay, I'm going to open up your head and you're going to be awake. We cannot do that. So there is a preparation process when this involves the patient building up a rapport with the entire team. And this typically happens through a series of interviews and conversations with all the doctors involved, with all the surgeons involved, the anesthesiologist involved, in fact, even the operating room staff, they talk to them. So when they do that over time, they very typically start developing a level of confidence. And as the confidence builds up, the stress and anxiety that they are prone to go through slowly starts coming down. And that is what makes this whole procedure possible.
So in your experience, has any patient shown resistance during the surgery?
Yes, we have. We have had people. In fact, what we try to do is to identify these people well before the operation. So if we feel, based upon our discussions, based upon a psychological assessment, if we feel that the person is not amenable or unlikely to cooperate, then we do not offer them the awake surgery. Or if a person says that, no, I'm afraid, I do not want to be awake through the operation, then fine. That seals it. So we don't push it. But it's all a confidence that they have. And as we do this, as we go through this whole process, say over the last few years, we have done more than 250 of these awake surgeries. And out of them, I can remember about maybe 3 or 4 where we have had to abandon the procedure during the operation, where the patient started becoming very restless and agitated, and then we resedated the patient. So we have had these, but then these numbers are very small because the process that leads up to an awake surgery is very elaborate. And that is when we understand the person, we understand the person's mind, and then we offer them. Yes.
Thank you, sir.
So, excuse me, sir.
Yeah.
Sir, can I ask something that happened, an incident that happened to my mother last 2 days before? She was offering prayer and suddenly she fainted and fall down. And we have taken her to hospital. So we thought that it was due to lowering of sugar or something that related to pressure. But after checkup, she was okay with the pressure and sugar. And the physician, he suggested that it might be something that related to the nerve system. Any problem, maybe swelling or due to imbalance. But
Mm.
still, she hadn't such a background. I mean, nothing related to such imbalance problem. And he had given medicine for 2 weeks. And after that, he suggested for an MRI. So, as a consultant in neuroscience, can you suggest me what could be that? What can I relate it with that?
Okay. One thing that I will avoid is to talk about specific situations here, and specifically where it concerns a patient's health, a person's health, because not having seen a person, I would be very hesitant to offer advice based upon a discussion with somebody. Okay, that is one. Now, if if the what the doctor has probably done is a very logical thing. Your mother had this giddiness and fell. The doctor has given her some medicines for that, and has suggested that yes, a scan may be required. Okay. So what will very typically happen is that when your mother sees the doctor again, and if your mother says that I'm absolutely fine, the doctor may even say, okay, since you're fine, we'll stop the medication and there may not be any need to check further. But if your mother still says that, yes, I continue to have problems, I continue to have this, or this is something that has been happening again and again, then yes, a scan may be, it may be wise to do a scan. So, in general, what we always say, a single episode, a single event need not raise these alarm bells unless it is something very significant. If it is continuous, if it is repetitive, or if there are other findings, if along with this, when the doctor examines a person, they find some other evidence, okay, there is something else related that is going on, then it needs to be checked further. Okay.
Okay.
Okay, a couple more questions here. Is memory loss and abnormal behavior symptoms of brain tumor? Yes, it can be. There is a part of the brain called the frontal lobe, which is what controls a lot of your personality and emotions. And any tumors here can a person who's otherwise who's normally very ebullient and outgoing can suddenly become very dull and withdrawn. Person might have very unexpected problems with memory, especially the short-term memory. Like very typically, what did you have for breakfast? Where did you go yesterday? Whom did you meet yesterday? Did you speak to this person? They'll have no recollection of that. Whereas a remote memory is generally preserved. That is very difficult to lose. So something like that, yes, it could be. But again, having said that, there are about a lot more reasons for these happening rather than a brain tumor, and that is what should be looked at. And here again, what I always say is a pattern. Now if it's see, all of us have this little bit of forgetfulness. As you grow old, as a hair gets gray, you tend to become a little forgetful. You tend to miss out on the words, or you tell somebody something, or someone tells you something and it kind of slips by you. That is not something to be really worried about. But if it's increasing, if it's happening, along with that, you have issues with language, your words are getting confused, you're having difficulty in reading. Yeah, okay, those are ominous signs, and those are worth checking. Okay. Is there any chance for tumors to spread to other parts of the brain from where it originated if undetected? Yes, it can spread. Tumors can spread, especially the cancers. They spread very fast. In fact, there is a kind of tumor in the brain, what is called the glioblastoma, uh, and that is probably one of the fastest growing tumors in the human body. It's extremely malignant, and that can grow extremely rapidly. In fact, even over weeks, we have seen it growing. So, yes, it can spread to different parts of the brain if it is not treated in time. Another question is, what are some of the post brain tumor surgical challenges? Like with any other surgery, there are challenges, there could be issues. So, and that depends a lot upon the person who undergoes this treatment, and where in the brain this is the tumor is located. The other factors related to the tumor, the size, the complexity, and how big it is, and what was the pre-operative status when they were first detected. So that is again very important, that I always say it is the health of a person at the time of when this thing is detected is a huge determinant of how the outcome is. A person who's well at the beginning is very likely to continue to remain well. But a person who has a lot of problems is very sick when a disease is detected. After treatment, the treatment course may be prolonged, and the response, the recovery after treatment can also be very delayed and sometimes incomplete. Okay. What is the difference between brain tumors and cancers? Cancer is a type of tumor. There are many tumors that are not cancers. Okay, now this is what we call the benign tumors and the malignant tumors. The malignant tumors are cancers. The benign tumors are not cancers. Is the overusage of phone a day and night can cause brain tumor? I answered this question. There is an advisory: limit the use of phones, especially for the youngsters, where we often see them with the phone stuck to their heads throughout the day and night. Good practice to lay off, to give it a break, or to use a phone when absolutely necessary. If you have to use a phone, either use a headphone or use a speaker phone, so you don't have the device plastered to your head all the while. Okay, but it's good to restrict your conversations. I know it's difficult, but please, that's something that will do you good. Okay, so I think that was the last question in the box. So if there are no more questions, I hope this brief talk has given you a better awareness. What is important? What is important and what our request is? There are lots of myths about brain tumors. When you talk to somebody, please spread the message that yes, there is a very scientific way of going about this. We cannot cure everybody. We cannot make everybody better. I mean, that is how diseases are. But in this day and age, there is a lot that we can do to help people through their illnesses, and not only to get rid of their illness, but more importantly, to get them back into their lives, which is equally important. So, thank you very much. It was a pleasure interacting with you. And
Thank you,
Sir,
sir.
some questions have been raised in the chat box.
yeah, I think I went through the chat box. Whatever I could see, I have answered. Let me see. Okay, there's one more. As a brain disorder, does brain tumor lead to essential tremors? Essential tremors is an entirely different condition. Essential tremors is a shaking of the hand that is often familial. It runs in families. That is not connected with brain tumors, but certain kinds of tumors in certain parts of the brain can cause tremors. But the essential tremor is something that is not related to a brain tumor at all. And can concussion cause tumors? And how to know if there's a concussion? After all, concussions do not cause tumors. Concussions do not cause tumors. And concussion is generally related to a shake of the brain after a fall or any kind of an accident where there's a jerk. The brain is like a jelly, so there's a shake. If it's a very minor shake, there's a you get a transient clouding of. I mean, that is when you find people who have fallen off the bikes or or hit somewhere. You tend to become a little dizzy for a while, but then you recover very rapidly. The more severe forms of it can lead to unconsciousness. If it's again brief, sometimes it can be for a few hours, sometimes it can be for a few days, but then they will usually recover. The more severe forms of concussion actually have structural damage inside the brain, and those are much more severe conditions. But again, there's no relationship between a concussion and a tumor. Okay. Good. So if there's nothing, uh, I will exit the meeting. My day
Thank
is
you,
just
sir.
have to get back to
Thank
my
you, thank you, sir, for the valuable information.
pleasure. Thank
Now
you.
I invite Evelyn of First
Thank you,
Become
doctor.
Taxation to deliver the vote of thanks.
Good morning, all. Myself, Evelyn V. Vijay, deem it great honor to deliver the vote of thanks and acknowledge the contributions of those who helped us in making this session a resounding success. First of all, on behalf of St. Albert's College and the Commerce Department, I would like to thank our chief guest, Dr. Dilip Panikar, Senior Consultant at Neuroscience, Aster Medicity, who spared time from his busy schedule to enlighten us with your commendable talk. You gave us an overview on the brain tumor, how it forms, its effects, diagnosis, treatments, and towards the last, the changes in focus of treatment. Thank you, sir. Then I would like to thank our HOD, Mr. Jeffrin Johnson, and our tutor, Ms. Elaine Albert, and other teachers for their moral support and guidance. Finally, I thank the student coordinators and all others attending this webinar for your cordial cooperation. Thank you.
Thank you, everybody.
Thank,
Have a good
thank you, doctor.